I am Dr. Sham Sundar, Consultant Radiation Oncologist at Precision Oncology Clinic. Today we will be discussing what radiotherapy means. Most of you are aware that radiotherapy is a part of treatment used in treatment of cancers. Radiotherapy is also called as radiation. So radiotherapy or radiation forms an integral part of any treatment of cancer. It can be a radical treatment, that is, radiation alone can be used in some cases. In some cases it is combined with chemotherapy, and in some other cases like in breast cancer and all, there is a combination of surgery, chemotherapy and radiation. So what does this radiation actually means? So basically the radiation that we use for the treatment is nothing but X-rays. These are the same X-rays which most of you will be familiar, that we use for taking an X-ray of the broken arm or of a chest. However, the strength of these X-rays vary. The X-rays that we use when we go for a simple conventional X-ray is less. Those X-rays are again used in CT scan also. So when you undergo a CT scan or a PET scan, it is the same X-rays that we use, which are a little more powerful. However, when it comes to the treatment, that is when we use these X-rays as a therapeutic option, the power of these X-rays are a little more higher. They are in the range of megavolt. So it will be usually around 6 to 15 megavolts of radiation or X-rays that we use. And the next question will be, how are these X-rays produced? So the machine that we use to produce these X-rays, basically to treat the patients with radiation, are called as lunacs or linear accelerators. These are a set of complex machine which uses electricity to produce the X-rays. Previously we used to use radioactive sources like cobalt-60 and others to give radiation. However, in this modern day practice of radiotherapy, most 95 to 99% of all radiations are done with linear accelerators or a variation of this linacs that we call. The next question will be, how does these machines work? So how these machines work is, once the X-rays are produced in the linear accelerator, we have special equipment attached to the linear accelerator which will direct these X-rays and which will modify and shape it according to the needs and the site that has to be treated. So this is where the complexity of the linacs come in. So we can provide a very small area of radiation, or we can provide radiation to a large area. So it is a very flexible machine that we have. So the treatment, the process of personalizing the radiation is called as radiation planning, for which we use a lot of algorithms and software to plan in a system called treatment planning system. We will not go too much into it, but basically for a simple understanding, linear accelerated is a machine which produces X-rays which can be directed, personalized and shaped to the purpose. And to do that, we use a planning system called as treatment planning system. We use a sophisticated algorithm and software to do that. So the next most common question is, how does one feel when they are subjected to radiation? To be very frank with you, the patient will not feel anything, because the X-rays that go in, they don't cause any sort of sensation, any sort of heating. Basically the patient will have no perception of being irradiated. So the patient will not have any pain, no sensation, no heat generation, nothing at all. So it will be an absolutely painless, harmless procedure. So then the next question will be, that means radiation will not cause any side effects at all? Not at all. See, during the treatment, patient will not feel anything. However, as the patient is subjected to repeated radiations over the treatment time, the patient does develop some reactions or side effects, which can be side effects on the skin, on the mucosa, or the site specific to where the radiation is being given. For example, if the radiation is given to throat, then the patient can have some burning sensation in the throat, or there will be some color changes on the skin of the neck. These things can happen, but they will be subject to whichever subject and what is the dose that will be treated. It will not be same for all the patients. Next, very important thing is, radiation is not only used for the treatment of cancer, but it is used in treatment of some non-malignant conditions as well. So, radiation, even though is an integral part, and majority of the indications for radiation are malignant, that is, are related to cancers. So there are also few indications where it is used in non-cancerous conditions. For example, some patients who have benign diseases, like meningiomas, schwannomas, and also keloids. Patients who have repeated formation of keloids, we can use radiation. And also in the of it has also been used in functional disorders of the brain. I'll be coming up with another video where I will explain the indications for non-cancerous indications for radiotherapy. Thank you.